Okay, one of the questions we get a lot of is, what do I do about my headaches or migraines post-op? And it does bring up the question, how can you tell the difference between a migraine and a headache? And sometimes that can be a little murky. But I'd like to talk to you about just being heavy and how that might cause headaches, and then why we expect that most of our patients' headaches will go away after the surgery and then come back to medications for headaches. It turns out that when we look at somebody who's overweight, they have a whole mix of abnormal hormones. They have high cholesterol, high cortisol, high adrenaline, high estrogen. And that mix leads to a lot of abnormalities, but one of the things is just extra water. So people who are heavy are a little swollen. They have swollen ankles. They have a little extra fluid in the chest and their lungs. They have fluid in the joints, and so oftentimes they get achy joints and things like that. Extra fluid pumped into the bloodstream, higher blood pressure. Higher fluid in the sinuses, allergies and sinus problems. And now imagine that same problem in your skull, which is a solid container, and pump a little bit of extra fluid into the skull. Can you imagine that would hurt? In other words, if I took you to the gas station and plugged you into the air hose there and went and took you up from 10 to 100, ow, it turns out the most common way we diagnose brain tumors is just increased pressure causing pain. So increased fluid causes increased pressure, causes pain, and lots of our heavy patients have increased fluid and increased pressure and have lots of headaches. So it's really common to say, gee, my patients are heavy and they're commonly diabetic. My patients are heavy and they commonly have knee pain. My patients are heavy, they commonly have high blood pressure. My patients are heavy, they commonly have swollen ankles. And as I look around the room and I say this, I'm getting the head bob, that I'm waiting for, if we were all African American, I'd be getting an amen, or, but I can see that, that's right. But you can see those are common things, and so one of the things that's common is the extra fluid causes headaches in our patients. And oftentimes the local medical doctor will diagnose these as migraines. Now, we didn't have too many people volunteer. They didn't know their weights this morning, but lots of people lose weight pretty quickly after the surgery. So quickly, it can't be fat. So we have Mickey, who's lost 15 pounds in 20 days or something like that. That's water. And we had Dennis here, who lost 8 pounds in 6 days. That's water. And so our average weight lost for our average patient in the first month, you may know, is 30 pounds. Probably mostly water, a pound a day. Now imagine taking 30 pounds of water out of your ankles. Hey, I got ankles again. Take 30 pounds of water out of a painful knee. Then say, oh gee whiz, Mickey was saying 3 weeks after surgery, her back felt better. How can that be? Maybe she's been, kind of brainwashed by my personality. Don't laugh too hard at that, actually. But should you really have recovery from back pain when you've only lost a little bit of weight? Well, what if it's water coming out of the joints in the spine? Just like if you may know, if you have a big swollen knee joint, you take it to the doctor, sometimes they'll actually put a needle in and tap off the fluid. It doesn't make it perfect, but oftentimes when you take down the pressure in that knee joint, so maybe Mickey's pain is improved because we've taken out some water. Imagine if we took out 150 pounds of water. Wow, that knee really does feel a lot better. And now let's go into your skull and take away 150 pounds of water. A lot of times we hope your migraines will go away. Now, but you're saying, I hear you, Dr. Rutledge, I'm hoping that too, but what if I get a migraine? And the answer to that is the migraine special medicines, the Imitrex and things like that are okay. But some people take Motrin and Tylenol and things like that. I do not recommend that for headaches after the surgery.
Excedrin?
No, absolutely, unquestionably, no. No Excedrin. No Excedrin. But we predict you're going to get over your headaches. So that's a good question. Does that answer that?
Yes.
Are there any over-the-counters that you can't take?
No.